Hi, it's Erie County Executive with another update on COVID-19. That's Erie County Executive Mark Poloncarz. Forgetting my intro, it seems like it's been doing this for so long now. And I'm here with Dr. Gail Burstein of our Department of Health, as well as Karen Gambino from Deaf Access Services. We have a little different setup today. Hopefully you'll be able to see the PowerPoint slides on the screen at the same time as I'm also talking at various points. As well as the doctor. We've acquired some new technology to make things a little easier for our friends in media, as well as the general public can see some of the screens. So we want to thank our staff that's working right across the room from me, wearing their face masks on that. And hopefully that does work out well so that we can continue to get accurate information out to the public and then take questions from the media at the end. As usual, the PowerPoint report, so to speak, the presentation is only as valid as it was when it was prepared approximately half hour ago. It's been updated multiple times through the day, and as always, there is information that probably our Department of Health and others are aware of that we're not even aware of at this moment. So we're going to go take things a little out of order. Because there was such a delay in getting information associated with the most recent cases and deaths. So we'll be talking a little bit about that afterwards or near the end. But we wanted to talk about the COVID-19 prevention and some reports that we've been getting. And I'll turn this over to the doctor, as she's much more adept and appropriate to talk about these issues.
Thank you. So I just want to remind everybody that works in the healthcare settings, not just the healthcare providers, not just the physicians or nurse practitioners or PA or nurses, but anybody that walks into a hospital for any reason or any type of healthcare setting, when you leave that facility, go straight home, strip, and put all your clothes in the laundry. Don't go grocery shopping. Don't do other errands. Remember, it's not just your body, the inside of your body that gets contaminated. It's also the outside of your body. What you're wearing can get contaminated with COVID-19 or other clothing. So I'm sure that many healthcare providers already have the habit of changing their clothes when they get home, just because they can be contaminated with different bacteria or germs. But please, please, please go directly home and put your clothes that you've been inside the healthcare setting working into the washing machine. Even if you've been wearing a gown over it, you really need to change your clothes and not go grocery shopping and possibly expose other people that have in those areas. Also, it's so important to wash your hands. Even when you're leaving the facility, give your hands like one last wash before you leave. Just remember, you want to make sure that once you leave the facility, you don't expose anybody else on your way home and also in your home.
Thank you, Doctor. We have unfortunately received some reports of healthcare workers, and I understand why. They're working very busy, long shifts, going straight from their job to grocery stores and the like, and we just don't believe that is appropriate based on standards, so please follow what the doctor talked about. And then there's a lot of questions regarding healthcare facilities. Doctor, would you like to take that?
Sure. So the New York State Department of Health regulates all healthcare in New York State. So hospitals, nursing homes, assisted living facilities, home healthcare, and hospice. So if you have questions, that the Erie County Health Department, we have no enforcement authority. So we, there's a very limited amount that we can do to change practices and investigate. So we recommend that you call the New York State hotlines for those type of questions. For hospitals, it's 800-804-5447. Again, it's 800-804-5447. And then for nursing homes, it's 888-201-4563. Again, 888-201-4563. 4563. And we work very closely with the New York State Department of Health, and we know that if there is an outbreak in a nursing home, we know that they are very involved. We've had some couple recent outbreaks with nursing homes, and we know the state is involved in really working with the nursing homes to help them address that issue.
Thank you, Doctor. Earlier today, I was in a conversation with Kim Minkle of the NFTA, and we were talking about transportation, and she wanted me to get the information out once again that NFTA buses and trains are for essential travel only, work, doctor's appointments, pharmacy, grocery shopping, and the like. She did say that 99.5% of their buses and trains have less than 15 people on them, and about 94% have less than 9 people. But they have gotten an occasional report of joyriders, generally kids. While they have suspended fare collection, it is only for individuals who are essential. It should not be used as an area to drop your kids off so they can have fun, but keep an eye on your children. We don't want them going onto buses. There are healthcare workers who are using the buses and trains to get to and from work. The doctor just said, hey, they got to go home and wash their clothes. You don't know what they were exposed to. You don't want to be on the bus. And in the NFTA, Metro is moving the summer schedule starting April 12th, and they are promoting that you use the rear doors to board and exit unless you have special needs or mobility issues to use the front doors. So we're reminding everybody that when it comes to our rapid transit, our buses, and the Metro Rail, it's only for essential people. It should not be just used by somebody who's bored and they want to go for a ride. You don't know who else is on that train. You don't know where they work. A lot of healthcare workers are using them, and you don't want to be exposed to whatever they may have been exposed to. And you will expose yourself potentially if you get on the bus and train with them needlessly. Free legal advice. The Erie County Volunteers Lawyers Project. Many law firms, of course, or almost all law firms are shut down. There are lawyers that are providing help from their homes, but there's a lot of questions that are coming in, including to our helpline, and we are not the appropriate people to talk to. So you can go online to the Erie County Volunteer Lawyers Project at ecbavlp.com, and there are attorneys that are available Monday through Friday at different hours, or from 10 to 2, they should say, to talk about family law questions, housing questions, to become a divorce client. I'm hoping that we don't have too many of those, but I'm sure that there's some husbands and wives that are sick of each other right now. Unemployment benefit questions and other cases. I'm not going to read all those numbers, but they are on the screen. Hopefully you can see them. But what we want people to know is there are lawyers out there that are offering free legal services, free legal advice, and you can reach them through the phone numbers that you see on the screen or at the Erie County Volunteer Lawyers Project's website at ecbavlp.com. And as an attorney who's not practicing anymore but still an attorney, I just want to thank my friends in the legal community who are providing free legal advice to our citizens at this time. It is important that people get these legitimate questions answered, especially regarding family law and housing questions and and unemployment benefit questions at a time when it's very difficult to maybe get in touch with an attorney because almost every law firm is closed. Mobile food pantries. The Food Bank of Western New York, which is also now known as Feed More Western New York, is providing mobile food pantries across Erie County. These are emergency food providers. Mobile food pantries are emergency food providers, are essential businesses. They're taking steps to minimize in-person contact and maximize social distancing. You can go to the Food Bank of Western New York website, which is foodbankwny.org or feedmorewny.org, to get the schedule of the mobile food pantries. I know today they're in the town of Colden in the southern part of Erie County. Seniors, you can call our senior service department phone number at 858-8526 for assistance with regards to direct meal deliveries to you, working with our friends in Meals on Wheels. And also 211 is available to answer questions regarding basic needs. We don't want anyone to go hungry during this period. We know that there's a lot of services that previously would have been provided that are not being provided now, and we want folks to know that food delivery is still one that's being provided. For seniors, call 858-8526 to schedule a potential drop-off through Meals on Wheels. And if you are needing food, the mobile food pantries are going across Erie County to provide assistance in various communities. Erie County responds. Well, we've been responding a lot. I think we're getting to a point now where everyone is working very hard, and we know that we have not reached our peak yet, so we are going to continue doing what we can to address this issue here in our community. We are scheduling people off. There are a lot of folks who don't necessarily want to take off, but we have to schedule them off so that we can have a staff that's available to answer the questions for you. The vast majority of our staff is home. There are staff that are, of course, working in the Rath building and in some of our other locations. Earlier today, I walked a number of the floors in which there was nobody on them, or very few. Took some pictures, including on the second floor in the Department of Social Services, and there were just a few people there. And normally it would be humming with activity, but there's a lot of people working at home too. And we just want to know that the response from Erie County continues. Earlier today, I signed Erie County Emergency Order 1.4 related to the COVID-19 outbreak. We were receiving unfortunate reports from employees that employers were prohibiting them from wearing masks, face coverings, or gloves while on the job, which we know the CDC recommends that when you are out in public, you wear a face covering. We're recommending when you're out in public, you wear a face covering. The best way to prevent the spread of COVID-19 is to have your face covering, and when I'm not talking into this microphone, I'm pretty much wearing it, unless I'm sitting in my office. Same with the good doctor here. And we want folks to know that I signed Emergency Order 1.4, which first off prohibits businesses from preventing entry to anyone wearing a cloth face covering, mask, or gloves. We've received reports elsewhere in the country that this was going on, including in major stores, and we are not going to allow that here because we want people to be wearing face masks at all possible. And I know there's some issues with security concerns, and there are still issues that, and I assume businesses will hopefully take precautions associated with that, but you cannot bar someone from entering just because they happen to have a face covering on. It also, the emergency order prohibits employers from preventing an employee from wearing a cloth face covering, mask, or gloves. We have had numerous reports of employers saying you're not allowed to wear that on the job. I don't want people to see you wearing that mask. They're going to question whether or not this is a safe establishment. Buffalo City Council President Darius Pridgen had advocated, after hearing a number of employers in the city of Buffalo were doing this, and created a petition on change.org. And I want to thank the council president for his advocacy in this. We got other reports of other employers saying, we don't want you wearing those. And what we're saying is, if any employer prohibits an employee from wearing a face mask, a face covering, or gloves, they're violating an emergency order right now of Erie County, and they're subject to the fines and penalties that can be derived from New York State executive law for the violation of an emergency order, which I do know, depending on the severity of it, could be a misdemeanor. And we certainly hope that there are no employers out there that are prohibiting their staff, especially those that are in direct contact with the public, from wearing face masks and gloves and coverings if the employee so chooses. It's not requiring it. It doesn't say the employee has to. It just says that if the employer, I should say the employee chooses to wear it, the employer cannot prohibit them. And then finally, as part of the executive order, directed employers to ensure that they provide employees opportunity for frequent hand washing. We certainly hope they're doing that. We know that there's a lot of employees of grocers and that are dealing with products that people are taking home. They're touching products that previously were touched by other individuals. So we're ensuring that the employees have an opportunity for frequent hand washing, or of course using the hand sanitizers that we hope are available for all employees, especially at grocers and markets. Mental health resources, you'd like to take this one, Doctor?
Sure. So as well as taking care of our physical health during this time, it's especially because this is a stressful period for everybody, we have to make sure that we take care of our mental health too. So we just want to let you all know about the vast mental health resources that are available in our community. And just because we can't go in person see somebody to speak with, there are other virtual opportunities for counseling. Last night at our Cedar, we virtually had one of my good friends who is a counselor, and she said she's busier than ever providing services for her clients clients or patients virtually online, and now it's easier because she can do it all from home, and so she can do it anytime that's convenient for her and her clients. So there is a comprehensive list of all local resources from our Department of Mental Health on their website at erie.gov/mental health. Also, if people are feel like very, very anxious and very, very depressed and really need to talk to somebody, they're in crisis, please call Crisis Services Hotline at 716-834-3131. Also, Crisis Services, remember, has an addiction hotline at 716-831-7007. And then Spectrum Cares also has a hotline to help families and children dealing with stress, and that is 716-882-4357. Those are all available on the Erie County Department of Mental Health's website, and please take advantage of this. This is a very stressful time, and we don't want you suffering. There is help.
Unfortunately, I was aware of another presumptive overdose death. Cheryl Moore, our head of our Erie County opiate task force, anti-opiate task force, informed me about an hour ago that it appears another individual just had passed after another individual, we believe, passed yesterday. So there is help out there for those who would need help with regards to an addiction, including those for opiates. Please call 831-7007. Just remember the James Bond number, 007, 831-7007. Essential businesses, this list has been updated. These are essential businesses: physical therapy and occupational therapy prescribed by a medical profession, landscaping, but only for maintenance or pest control, not for cosmetic purposes. So putting new mulch out, putting new plants, the answer is no, you're violating the law. So you can go out there and you can maintain by cutting grass, I guess trimming bushes, but pretty much nothing else. So for the landscapers that are going out there and they're going to buy tons of mulch for people and think they can put it out with new flower beds, first off, I wouldn't recommend it today because we had snow in the morning, but you can't do it. You're violating the law. So the landscapers are only basic maintenance, such as cutting grass, pruning bushes, nothing else. Pest control, which I'm not certain how many landscapers are involved in pest control, but that's considered essential. The other work is not essential. And if you continue to violate the law, I guarantee you, I know we're getting lots of calls to our call center, as well as New York State's getting lots of calls about landscapers. They're going to send the law enforcement out. And you don't want to get hit with a $10,000 fine just because someone wanted mulch on their lawn. Simple as that. Automobile manufacturing has been determined to be essential, though as we know, a lot of GM and Ford are still closed. Services related to financial markets are essential, except debt collectors. We know early on there were debt collectors that were trying to operate, and New York State has determined debt collectors are not essential. So any debt collector who's out there, you're going to get hit, and it's my understanding you might get not just hit for your opening, but if you're attempting to collect debt on individuals, you can be penalized for each individual that you attempt to collect debt on. So debt collectors, stop it. And then there's been updates to construction services. Now, updates to essential businesses. Golf courses earlier today were determined to be non-essential. That's public and private golf courses. And I know there were a number of golf courses that were open, and many were trying to follow social distancing guidelines, and were doing that. Others were not. And as a result, all golf courses are closed. So for those few of you that decided to go out there and ignore social distancing guidelines by just pushing as many people through tee times as you could and so forth, not having limitations on cart usage, you just guarantee that your golf course is shut down until April 29th. That's what New York State ordered earlier today. We have to follow that order. So to all the public and private golf courses out there, you are now closed until April 29th. You can have essential staff maintaining the golf course, but you cannot have a golfer on the golf course. So those are the rules. We were worried about it. We were behind the scenes telling some of the golf courses that seem to be violating the rules with regards to social distancing. You're going to hurt it for everyone, including yourself, and now they have. So they're closed until April 29th. Boat launches, marinas for recreational vehicles. I don't believe those are not essential. Should really say updates to non-essential businesses on this one. Lawyers, sorry lawyers, you're not essential. You got to work from home. Real estate, you can conduct transactions remotely, but you cannot do house, like house types of walkthroughs and stuff like that. Go to Empire State Development for all the details. That is esd.ny.gov. Erie County does not make the determinations on these. We've had people really angrily call our office, threaten people, send nasty emails saying, I can't believe you decided to shut down my business, Mark Poloncarz. We do not. It's New York State that determines what's essential and not essential. We enforce the law. We don't make the determination on essential and non-essential businesses. But these are updated, and once again, this slide here should say updates to non-essential businesses, because golf courses, boat launches, lawyers, real estate are now determined once again to be non-essential. Donations, we've had lots of donations. We want to thank Lamar Advertising for their most recent digital billboards that they donated for Erie County, telling people exactly what we've been saying: stay home, stay safe. If you stay home, stay inside, you will save lives, because we'll stop the spread of COVID-19. Cases, deaths, and isolation. So as of 2:30 today, there are 1,432 total positive cases for all labs in Erie County. Unfortunately, I have to report that another 5 individuals, because I believe we were at 46 yesterday, have perished. So 51 people have died from COVID-19 in Erie County, and once again I want to offer my deepest condolences to the families and friends. These are not numbers, these were people. These were mothers, fathers, sisters, brothers, grandparents, cousins, mentors to many people. And I've known too many people who've already lost a loved one, whether in here, Erie County, or elsewhere, as a result of the coronavirus outbreak. So while we have 51 people have died, I want everyone to remember that that was an individual who played an enormous role in other people's lives, and we offer our deepest condolences to those who've lost a loved one. Positively, 360 people have recovered from the coronavirus. There are currently 1,021 people in isolation. We're got some good news we'll talk about in a second. I'll turn it over to Doc to talk a little bit more, but 216 individuals were hospitalized as of yesterday's report, which is for the day before, so it would have been for April 7th. Of those, 118 were in ICU, and 111 of those had an ICU airway assist. So we're actually seeing a little stabilization on the hospitalization. That's a good thing. We haven't seen rapid growth there. Before we get to that, though, we want to talk about the deaths. We have had 51 deaths. 61% of the deaths have been age 70 or older. This is the latest data as prepared from the Erie County Department of Health. One individual died in the age range of 30 to 39, a woman. One male, 40 to 49, and 2 females between the age range of 40 to 49. 2 males, ages 50 to 59, and no females. And then we see a big jump up between the ages of 60 to 69, 8 males have died and 6 females. 70 to 79, 5 males have died and 4 females. And then 80 plus is the largest group. As we've always said, the elderly are most at risk for COVID-19. And 12 males have perished and 10 females have. Doctor, would you like to add a little bit more regarding some of the statistics and what it means?
So, we know that our most vulnerable to the COVID-19 are our elderly, our seniors, and so that's why it's really important that if you have a senior in your life, you make sure that they're staying quarantined if they're well, and they are, and then if they are ill, make sure that we, monitor them, contact their healthcare provider, really help them through it, bring them food. We have a plan with my parents who are in their 80s that, they get food and medicine from the outside. We've banned them from going to the store. So it's it's really important to keep our seniors safe. Also we know that many people from national data and international data that succumb to the COVID-19 infection are people who have other chronic health conditions, like even high blood pressure that is unfortunately so common here. I mean, those individuals are at high risk. Smokers, I mean, we know there are a lot of people that use tobacco products, whether being the traditional cigarettes or vaping. And we know those individuals are at very high risk. And people with any type of chronic lung disease or chronic heart disease or renal disease or any type of immunosuppression, I mean, those individuals are really high risk. So we have to take care of them. If you have a loved one that meets any of those categories, or if you're in any of those categories, we have to make a plan, make sure that they minimize their activities of going out in the public, and by helping them to get food, or if you're an individual, have a plan. Someone bring you food. The stores can deliver, and medication, and that's something that's all really important, just to keep our most precious people in our community healthy.
My parents, very similar to the doctor's parents. As the county executive, I can do executive orders, and one of them is I ordered my parents home. My mother's listening. My dad, Charlie Polencar's choo-choo, wants to get out, as I told him. And others, if he's caught on the streets, I've told the Lackawanna Police to bring him back home. I don't want them to put themselves at risk, like we don't want any of our senior population to put themselves at risk needlessly. So I know my mom and dad are watching. You better be watching at home, and if I find out that dad's on the street again because he's bored at home, he's in big trouble. And it took me 52 years to be able to do that to my father, but I'm glad I can do it.
Grounding him?
Yes, he's grounded. Choo-choo Polencars is grounded. Well, getting back to more serious things, the hospitalization chart, a little plateauing, and we're happy about that. Doctor, would you like to talk about it?
Sure. So even though it seems like we are plateauing a bit with our hospital admissions, remember those are COVID hospital admissions. There are other people in the hospital too, and I think what we really have to pay attention to is many of these individuals are in the intensive care unit, like over 50%, and almost all of those individuals are in the ICU. And remember, we're seeing this kind of like lull in increase of new admissions because of the good social distancing that we did 2 weeks ago. And so we want this curve to continue in this way, we have to continue our social distancing and other non-pharmaceutical interventions. What we do today will affect what we see on this graph in 1 to 2 weeks' time. So that's all really important. And then also, I want to give a call out to our healthcare providers, my colleagues in the field, really putting themselves at risk to take care of the very sick individuals for our community. So I just want to give them a shout out and say thank you.
I have to agree with that. The healthcare workers are the true heroes of what's going on in this community, and I want to thank them for all that they're doing as well. Mapping, of course, we have the multiple maps, the county maps, which show towns and zip codes. We talked yesterday about how zip codes are not apples to apples comparisons. And of course, the state is mapping, and the state has in the last couple days has increased Erie County from the yellow to the orange because we have more than 1,000 cases now. We are nowhere near our peak. I just actually saw a comment from my colleague Steve Malone in Suffolk County, and they are weeks ahead of us, and they don't even believe they're at their peak. And they're seeing increased hospitalization, increased cases. So we just want to remind everybody that the thought that our peak is going to come in a day or two is not justified by the number of new cases that we're seeing, though we are happy to see a little bit of plateauing with regards to the hospitalizations. But you can do comparisons of county by county on the statewide map, and of course can do comparisons and look at what's happening in your own community on the county map, which of course is erie.gov/COVID map. The call center is open from 8 a.m. to 8 p.m., 858-2929. The call volume can be very high at times, and you can get right in at other times, just depends on when you call. And I guarantee you after this session is over with, their call volume will be up, because it generally is after we finish a television briefing. But once again, the number is 858-2929. Lots of information online that you can get from Erie County, erie.gov/COVID-19. The New York State Department of Health has a fairly long address there, which hopefully you can see on the screen. And the CDC is easy. It's coronavirus.gov. Great information for all kinds of entities, including businesses, healthcare professionals, all different fields, especially on our Erie County one, so that if you have any questions, go to the website first. If you can't get it answered and it's directly health-related, you should call our hotline at 858-2929. We may not be able to answer every question. Some people are complaining because we can't answer every question. That's just where we have individuals there that are working very hard, but they may not be able to answer your question at that moment, but hopefully they'll be able to direct you to the source that can. Once again, our important COVID-19 webpage, erie.gov/COVID-19. And with that, we will open up the lines to questions from the media. I just ask that the media that if you have not been called on, if you could just mute your phone. First,
we have individuals there that are working very hard, but they may not be able to.
So could one of the members of the media who does not have their phone unmuted, because we're picking up your. Okay, we started yesterday with the W's and TV, so we'll start at the bottom. Is anybody on from the Associated Press? Investigative Post, B News. I know we have the Buffalo News, Sandra Tan and Aaron Bessiker. Sandra, would you like to go first?
If I could go first. The county had set aside $5 million to help respond to the COVID-19 pandemic, and it's my understanding that about $2.8 million of that has already been spent, but that of all of the purchase orders that are out there, only about a third are coming through to the county, and the rest are being intercepted and redirected by FEMA. Can you?
That's not correct. We're not aware of anything being intercepted by FEMA. We've had purchase orders that are canceled, or we've been told they're being delayed, but we've not had any that have been intercepted. I have heard of reports of orders elsewhere being intercepted, but we are not aware of any order being intercepted by FEMA. We have had cancellations. In some ways right now, we have more orders out than money that was allocated by the $5 million under the assumption we're going to be getting very soon the COVID-19 stimulus funding from the federal government, which is over $100 million. But I do want to correct, we have no evidence that FEMA has intercepted a county order. We have heard of FEMA intercepting other orders, but what we've had are cancellation of some of the orders that we processed or delays for various reasons.
Right, because you had mentioned that there was an order you were hoping would arrive next week, but that has been delayed?
That is correct.
Okay.
And we have other orders that we're working on right now, some that we believe we may actually get in the next few days. Our goal is to process and try to get orders first from vendors in the United States. And thankfully, some of the vendors in the United States are ramping up and actually producing product now. But the vast majority of product, unfortunately, N95 masks, and there's varying forms of N95 masks, procedural masks, also known as surgical masks, gowns, face shields, and so forth. The vast majority of those vendors are overseas, primarily from Asia. There are some that are European. Our purchasing team is working very hard to obtain the PPEs from sources, many sources, legitimate ones as possible. We've had a lot of, I don't want to call them necessarily fly-by-nights, but we've had a lot of companies that are not the strongest, let's put it that way, who are saying we can get you X, Y, and Z, but you got to pay us up front. And we're not going to put out millions of dollars up front to a non-reputable firm. So we're going through reputable firms, those that have been previously approved by NIOSHA, the National Institute of Occupational Safety and Health from the CDC, as well as FDA-approved entities. Joe's N95 mark, we're not going with Joe's N95 mark. But unfortunately, there's not as many of them that are NIOSHA and FDA approved. I know, Doctor, we had a number of potentials for N95 masks that turned out not to be N95 masks. You want to talk about some of the problems that would happen as a result of that?
Yeah, so I mean, they've their people are falsifying their products, and they are not N95 masks, or they're defective. They have leaks in them, and putting healthcare workers at risk. So we just have to make sure that we have a true product that is going to protect our healthcare workers. And there are so many scams out there.
Yeah.
I mean, even in the lab world, with these antibody tests that are being put on the market, they're not FDA approved. So I mean, we are trying to get as many resources as we can into our community. However, we have to make sure that they're real resources and they work the way that they say that they will.
Aaron, do you have a question?
Sure. Hi. I was wondering, in terms of, you said you have the surge or the peak still down the road. How well do you think area hospitals are prepared for that?
Well, we are in contact with area hospitals with regards to personnel as well as PPE usage. I actually was in contact earlier today with all three of the CEOs about their what they have on hand and what they're going to need. If our orders come in, we'll be able to help the hospitals meet their PPE needs for at least, I think, the next month. And that's good because we know we're going to get a surge in the next month in all likelihood. But we got to get those PPEs in. And of course, we are worried about staff at hospitals. They're working very hard. Just like we're worried about burnout, I'm worried about their hospital workers burning out. So I have been in touch with each of the CEOs at various times to talk about those issues. And I think we're like any other spot in the United States. We have incredible workers in our healthcare profession. We're just hoping that we can do the best possible to prevent a surge of a ridiculous amount of patients coming into our hospitals all at one point, because then we would not be able to handle it. We have been able to handle it so far. That's a good thing. But our projections still show that our peak is a number of weeks out, and so we are afraid of what could happen in a number of weeks. The Spectrum News, Stephen Marth.
Hi, County Executive. My question for you, we are hearing from callers to the newsroom that there might be some salons and barbers trying to circumvent the government's pause, or the governor's pause order, by operating out of homes, doing home appointments from their home or their customers' homes. Is the county aware of anything like that? And if so, what penalties could someone violating the order like that be facing, in addition to the fines that you've talked about? Is there anything else that could happen?
I'm going to have to get back with you on that. We've had competing statements with regards to whether an individual could cut hair like in their home. Salons and barbershops have to be closed. So if anybody's in a salon or barbershop, it has to be closed. We've heard that like a family member could cut another family member's hair, but there's questions as to whether or not a barber or a hairdresser could do it for someone else. So I'd have to get back with you. I'm not exactly certain. And I don't think we've got any recent calls, but I know there's been some people that have been saying competing things. Empire State Development is the best to talk about that, because they're the ones that are actually determining the essential businesses and how somebody can work if it's just a sole practitioner, so to speak.
And we have information on our website about where you can call if you're suspicious of a business operating illegally, and the governor actually has a task force to investigate those, and if they turn out to be true, they push that information back to the county, and then if it's a restaurant or bar, the health department will work with the sheriff's office to close it down and report them to the liquor authority, as you've seen that we've done. And then the local police departments and the sheriffs also have now the authority to work with their building code regulators to close down those businesses that are operating illegally. So there are opportunities for enforcement out there. We just have to be sure that they are investigated appropriately, and to ensure that that whether they are legal or not, or essential or not.
Okay, you're welcome. WBEN, Mike Baggerman.
Hey, Mark. I was wondering if you're considering a proposal that was done by your counterpart down in Broome County. They're essentially having people born in odd years go out and do whatever they need to do, like grocery shopping on odd days. People born in even years will go out on even days. Is that something you're even considering?
It's the first time I've heard about it, so I'd have to consider it. I'd have to talk to our staff and others to determine if it's even feasible. But it's the first time I've heard about it, Michael. I was unaware that his name is Jason Gardner, my colleague in Broome County. I'll probably give Jason a call just to see why they did it, and is it making a difference or not. Channel 2, WGRZ, Jeff Preval, Emily Watkins.
Yeah, hi, County Executive and Dr. Burstein. On the emergency order, could you specify or name any organizations or businesses that have not allowed their employees or patrons to wear face masks?
I'd rather not, because at the moment when we received the information, there was no prohibition against what they did. So I'd rather not name, but we did receive information about employers that were telling their employees you cannot wear a face mask while on duty. And because it wasn't illegal per se, there was no executive order, even though the CDC is recommending that everyone wear a mask when they're out in public. I'd rather not name the entities. Now, if an individual violates the order now, of course, I'll be glad to name the entity. But because there was no violation of an order at that point, I don't think it would be fair to name those entities.
And could I just ask another question? Maybe over a week ago, hospitals across the state, they were asked by the governor to submit surge plans. Do you know of hospitals locally here that have had their surge plans approved, and can you, or perhaps denied, or and can you provide an update on the convention center?
The first question I can't answer. I don't know about whether the surge plans were approved. The convention center is all still, nothing will move until it's been approved by New York State and FEMA. They're watching and monitoring our hospitalization rates. If they see an uptick in our hospitalization rates, then I believe they may approve it, but as of right now, it has not been approved. Channel 4, WIVB-TV, I think we have Melanie Orleans.
Hi there, good afternoon. Thanks for taking our question. So obviously this Sunday is supposed to be Easter. Well, it is Easter, Passover underway. There are going to be people likely out there who are going to defy those social distancing guidelines and pause orders. So does the county plan on putting extra enforcement out there to check and make sure people are abiding by those orders? Is there any sort of extra enforcement that is going to go around to these neighborhoods or certain areas where there have already been reports of people not adhering to those orders?
Well, I've actually been in touch with a number of members of faith-based communities and pleading with them not to hold services. They would be in willful violation of the order, and they could theoretically be subject to, and as a willful violation of the public health order, that's a misdemeanor. If they put the public at risk. I know most faith-based leaders are taking this exceptionally seriously. The Catholic Church, of course, has basically canceled all services. It is the holiest day of the year, Easter. Tomorrow, of course, is Good Friday, and it usually is a very busy day in churches across the community with the Stations of the Cross. Holy Thursday is today. It's also a very important holiday or holy day on the Christian calendar. Passover, one of the most important religious ceremonies and times for our friends in the Jewish faith. I'm just asking once again that religious leaders, pastors, ministers, do not open your churches. Do not have drive-in service. We've heard of some that plan on having tell their congregation to drive into the parking lot, and we will minister you there. That's a terrible idea, because you're bringing people into a close area. Even if they're still sitting in their cars, they're going to have the windows open. You're going to want to approach them. We're asking you don't do that. We want everyone to have the happiest Easter possible on Sunday, and the best way I believe you can do that is to watch. A lot of the local churches are going to be having online services. Watch the online service for your church if it's being held, and celebrate with your family at home. There'll be hopefully for each and every one of us, plenty of holidays in the future, plenty of Passovers, plenty of Easters for us to celebrate. We don't want to go out, expose ourselves to COVID-19, which is all across the community, and potentially put ourselves or others at risk. Channel 7, Madison Carter, and I believe also Hannah Bueller.
Yep, Hannah,
Good
if you want to go
afternoon.
ahead first.
Yep, good afternoon. This is Hannah Bueller. Thanks for taking our questions. My question is for Dr. Burstein. Doctor, I just got done speaking with a recovering COVID-19 patient who says that her discharging doctor from the hospital told her she could be shedding the virus up to 37 days after being officially diagnosed with COVID-19. Is this true? And if so, how does it fit into the 14-day isolation? Should those who have tested positive be isolating for longer than 14 days?
Well, there's a lot we don't know about the virus now. Right now, the CDC and the New York State Health Department is recommending that people stay in isolation for at least 7 days after the onset of their symptoms, and the last 3 of those days should be fever-free without any treatment for the fever. And then for another additional 7 days, people should remain, in quarantine with a mask on if they do go out, just to ensure if they are shedding any virus that they stay away from other people. And then, everybody's different, so that we actually, don't know exactly how long most people will shed virus. We believe it's up to 14 days, and but we'll really need more experience now. And because of our testing capabilities, we're not able to do follow-up testing on individuals that have recovered. So again, there's not that's a really more of a data-free zone, and we'll need more time and more research to be able to answer that question.
Okay.
And then Dr. Burstein.
Is that
Sorry,
Madison?
go ahead.
Is that Madison?
So I just had I had a second question. This is Madison. In some of the data that you've been releasing to us in regards to race, I know that this is an issue with our national government. About 90% of the Hispanic and Latino population is counted as white. Is that reflected in the data that we're seeing from you?
Well, the data that we receive, first of all, the data that we receive from the New York State Health Department on race ethnicity is really not the strongest variable of surveillance. That many times that is an unknown, it's not reported, or it can be inaccurately reported. So that's why it's more difficult for us to release those data. And many times, again, it's not included in the health reports that we receive, and then we would have to go into HealthyLink to try to dig that up. So again, the race data are not the best data. I mean, we know that because of health disparities, that many times people of color are suffering from other chronic conditions that place them more at risk of severe illness and complications with COVID-19. That's why we want to make sure that everybody that has any type of chronic condition, even high blood pressure, which is so common, is very aware that this could affect them. That they stay, if they're well, they stay in quarantine as much as they can. Try to avoid going out for anything, even grocery shopping or pharmacy. There are get a friend or a neighbor or family member to get that delivered. And you're right. I mean, those are individuals that are at risk, and we don't have the greatest data on race ethnicity, and that's a national problem and a state problem.
I guess I'm just asking is as you understand it, the HealthyLink system counts Latinos as white?
That's something that you would have to ask HealthyLink.
I have no answer. I don't know.
Yeah, that's something that you would have to ask HealthyLink. How they categorize it. I believe that they categorize it the way that the federal government categorizes it, but you would have to ask them.
Are there any others during this first round that were on that I did not? Because I know Dr. Burstein has to go. So thank you, Doctor.
Yep,
I know
thank
have to
you.
run. I'll be around for one more round of questions.
Remember, keep up that social distancing. Let's make sure that curve gets squished and spread out, and we're all going through it together. So thank you. Enjoy the holiday.
Thank you, Doc, and hope you once again had a happy Passover. And going back from the top then, AP, Investigative Post, B News, Buffalo News.
Yes, Sandra Tan again. In light of the fiscal stress the county is under, we have been seeing other counties talking about furloughing their employees, and I'm wondering if that's something that you guys have considered for Erie County. And secondly, we're also hearing, and I don't know if there's any truth to this at all, though, that there have been COVID-19 infections that have struck the Department of Homeland Security and Emergency Services, including the leadership team, and I'm wondering if there's any truth to that.
With regards to the furloughs, right now we are paying all employees, essential, non-essential personnel. If this continued for weeks and weeks and months, we would have to consider furloughs. We're coming off of one of the better cash periods that we have because we just received our property taxes, about 96%. So we do have cash on hand, but if this extended for a period, we would at that point consider it. We certainly have essential personnel that are going to have to work. We are hopeful that the federal government approves what would be considered stimulus package number 4 for COVID-19, which would address shortfalls as a result of revenue losses. If that's the case, I think we'd be fine, but it is something I'm concerned of. In regards to the Department of Homeland Security and Emergency Services, I will not go into individual cases, but as I said earlier, there was an individual who was actively involved in the response to the COVID-19 in Erie County that had previously tested positive for COVID-19. We are aware of a number of individuals who are based out of the Emergency Operations Center and the Fire Training Academy. This is also in conjunction with the unfortunate outbreak that occurred with regards to the Buffalo Fire Department. The Emergency Operations Center and Fire Training Academy has been used by, and still is used by, members of our Homeland Security and Emergency Services team, as well as the Department of Health. It has been giving the biggest cleaning you can ever imagine, but there are a couple of county employees who have suffered COVID-19, including those in the Homeland Security and Emergency Services Department, which is not totally surprising when you look at the first responders in our community, fire and police, who have tested positive. And I am aware that there are first responders in suburban communities that have tested positive, just like you have had in the city of Buffalo.
Thank you.
Okay. Aaron, did you have?
I got one more.
Sure.
Thanks. You mentioned the other day that the county has approved locations for some mobile refrigerated containers to accommodate excess bodies if needed. I was wondering if you know where area hospitals are now in terms of their morgue capacities, and how soon you might need those containers.
My understanding is area hospitals are okay at this point. While we have had an uptick in deaths with regards to COVID-19 illness, we have also thankfully seen a reduction in some other deaths, such as auto accidents and the like, with less people on the road. So our morgue is at this point not near capacity, and my understanding is neither are the hospitals. In most situations, if a person passed, they would go from the hospital to the funeral home. They would not go to our morgue. So right now we're okay, though I, of course, would be concerned in a situation where we had a surge of patients that we may need, like they unfortunately need downstate, the refrigerated facilities, whether they're refrigerated trailers or the like. But thankfully right now we don't need that. Stephen from Spectrum, do you have any more questions?
Yes, just one. I was wondering if the emergency order that you issued today concerning the businesses and the masks and gloves, could you elaborate what type of penalties these businesses could face if they violate your order?
It's the same as any violation of an emergency order which is New York executive law. We can get you all the details, but it can be stiff fines, up to $10,000, as well as if it's a willful disordering, it could be a misdemeanor, but we can get you all that offline.
Great, thank you.
Channel 2, Jeff Preval, Emily Watkins. Do you have any more questions? No one's there, I guess?
I think we're good. I think we're good.
Okay, thank you. WIVB, Channel 4, Melanie Orleans. Do you have any more questions?
We are good, thank you.
Okay, thank you. You're welcome. And finally, WKBW, Channel 7, Madison and Hannah. Do you have any other questions? I guess not. If not, I want to thank
Mike from WVU.
Oh, Michael, I'm sorry. Do you got any more questions?
Yes. Regarding that emergency order, forgive me if you've mentioned it already, but how can somebody report, say, an employer telling them that they can't wear a mask or any PPE at work?
They should report that to our helpline, the hotline at 858-2929. If we do get that report, we would send a sanitarian out because it's part of the public health code right now, so to speak, with local law enforcement. So they should report it to 716-858-2929. And with no further questions, I just want to thank everybody once again for your good work in protecting our community with regards to smart social distancing. We know not everyone has done it. And one of the reasons why I had to sign the emergency order today is because we had some businesses that probably weren't doing the right thing and prohibiting their employees from wearing masks. If an employee wanted to, and in this situation, they should be allowed to. So I want to thank everyone for following all these smart social distancing guidelines. Tomorrow is Good Friday. Erie County government technically is closed. The Department of Health, as well as the hotline, will be open. But the vast majority of county government, what is still operating, which isn't that much to begin with, will be closed. We are not planning on having a press briefing tomorrow unless something really bad happens that we need to talk about. So this will be the last press briefing until Saturday. For those of you who celebrate Good Friday, I want you to have as most solemn Good Friday as possible. I know it's going to be different than usual, as there will not be stations of the cross as you normally might participate in, though I do understand that a number of the churches, including the Catholic Church, will be providing video stations of the cross for those who want to participate in it at home. I wish everyone the best. Be safe, be well, and until we see each other again, to get the most accurate information and the latest updates, pay attention to our web pages, the COVID-19 page, erie.gov/COVID-19, as well as our map, which will be updated throughout the day with new figures as we get them regarding positive cases and the like, and that can be found at erie.gov/COVID map. Take care, everyone, and be safe.